This module will discuss kidney transplant, which is an option for kidney failure if you are doing well enough to have the surgery. In this module, we will explain what a kidney transplant is and the types of kidney transplant. We will talk about who can have a kidney transplant, what the transplant workup means, the transplant waitlist, and a bit about the transplant operation. We will discuss the benefits of a kidney transplant and what other things do you need to consider when deciding about kidney transplant as one of your options to treat failing kidneys. Kidney transplant is the best choice of treatment for kidney failure, but you must be healthy to get a kidney transplant. A kidney transplant involves placing a healthy kidney from another person into your body. The person who gives the kidney is called a donor, and the person who receives the kidney is called the recipient. A donor can be a living person. This is called a living donor. A donor can also be someone who has died. This is called a deceased donor. Kidney transplant is a treatment for kidney disease, but is not a cure. As just mentioned, there are two types of donors, a living donor and a deceased donor. Therefore, there are two types of kidney transplant, a living donor transplant and a deceased donor transplant. A living donor can be a family member, a friend, or someone you do not know. It is important for you to know that a living donor does not need to be a blood relative. A deceased donor is someone who has passed away, and the family has given permission for their organs to be used to save the lives of others. Kidney transplants are done in only a few hospitals in each province in Canada. A person who is donating a kidney must be healthy. The workup to be a living donor can take 6 to 12 months before kidney transplant surgery is scheduled. Living donor kidney transplants can be done before a person needs to start dialysis for kidney failure. This is called a preemptive transplant. A living donor transplant is best because the transplant can be scheduled at a time convenient to the donor and the recipient, the person getting the transplant. Living donor transplants generally last longer than deceased donor transplants. A living donor can live a normal life with only one kidney. What happens if you and the person you want to give a kidney to are not compatible? What does compatible mean? Compatible means that the blood type should match and the person receiving the kidney does not have any antibodies in their blood that would damage and potentially destroy the new kidney. The paired living donor program can be the answer if you and your donor are not compatible. To explain, Joe wants to give his kidney to Mary, but they are not compatible. Anne wants to give her kidney to Violet, but they are not compatible. But Joe and Violet are compatible, and Anne and Mary are compatible. So, Joe can give his kidney to Violet, and Anne can give her kidney to Mary. This is called paired living donors. Often, there are multiple pairs in a chain of kidney transplants. You must be healthy to be considered for a kidney transplant. So not everyone who has kidney failure is suitable, and sometimes the risk of kidney transplant is too high. So, what does this mean? Good health means not having an active infection or cancer. If you have had a previous cancer, there is a waiting period for you to be cancer-free before you can have a kidney transplant. The waiting period depends on the type of cancer you had. The reason it is important that you do not have an active infection or cancer is because the medications used to prevent your body from rejecting your new kidney can make the infection much worse or the cancer to grow more rapidly. Also, to be considered healthy enough to be suitable for a kidney transplant, your heart, lungs, and liver must be working well. If people are healthy for a kidney transplant, they must agree to the idea of a kidney transplant and accept the risks involved. The risks of kidney transplant include the risks of the surgery and the general anesthetic, being put to sleep for the surgery, as well as taking the anti-rejection medications. These are the medications that prevent your body from damaging the transplant kidney. The person who is suitable for a kidney transplant must be willing to go through all the transplant workup tests, the transplant surgery, and be willing and able to take the anti-rejection medications. Having a kidney transplant is a gift that needs to be taken care of. The transplant workup will determine if you are healthy enough for a kidney transplant. There are many tests that are part of the transplant workup. These tests are very important because they ensure that you are healthy in body and mind. Being healthy in body and mind helps you go through the surgery and aftercare with success. The transplant workup includes a general health assessment, including your weight. Being very overweight increases the risks of surgery and poor transplant outcomes. There are many blood tests needed to determine blood and tissue type and antibodies that you may have developed. If you have lots of antibodies, this makes getting a compatible kidney more difficult. You must be compatible with the donor of the kidney, living or deceased. Heart, lung, and liver tests will be done to make sure they are working well. Some of these tests may be blood tests, but you may also need ultrasounds, breathing tests, and dye tests for your heart. You will need to see the dentist, as your teeth and gums need to be in good shape before the kidney transplant. Having poor teeth or an infection of the gums can lead to decreased transplant success. A woman who wants to have a kidney transplant must have a pap smear and a mammogram. This is to be sure that there is no cancer. A man will need to have a prostate exam. This is to be sure that there is no cancer. Some people will need tests on their arteries, veins, and bladder to be sure that the surgeon can attach the new kidney to your blood vessels and bladder. Everyone will have a social worker or psychologist assessment. This is because the transplant journey can be a difficult one. The transplant team needs to know what type of family and social supports you have to help you along and what supports they can help you with. Once the transplant workup is done and you are eligible for a kidney transplant, you will be placed on the transplant waitlist. The transplant waitlist is for people who do not have a suitable living donor and are waiting for a deceased donor kidney. How long a person is on the deceased donor waitlist depends on several things, such as your blood type, how many antibodies you may have, and how many organ donors there are in your region. It is therefore very important to continue to look after yourself while you are on the transplant waitlist. You will continue to have regular reviews by the transplant team. Keeping healthy while on the transplant waitlist means keeping to your regular dialysis schedule, following your diet and fluid restrictions, taking medications as prescribed, try to do regular physical activity to control weight, visit the dentist regularly, be a non-smoker, keep vaccinations up to date, and avoid blood transfusions if possible. The transplant surgery takes about 2 to 4 hours. The transplant surgeon makes an incision in the lower belly on the right or left side. The surgeon connects the transplanted kidney to your blood vessels that go to your leg and to your bladder. Your blood flows through an artery into the transplanted kidney, and a vein takes filtered blood out. Your urine flows through a transplanted ureter to your bladder. Your own kidneys that are not working very well are not removed unless they are so big there is no room for your transplanted kidney, or your old kidneys are chronically infected. If your own kidneys need to be removed, this must be done before the kidney transplant surgery. After the transplant operation, you will need to be in hospital for about 1 week, but everyone is different. Some people may be in for a shorter or longer time. There will be a catheter, tube, in your bladder to drain the urine or pee. This catheter is in for a few days after the operation. The transplant kidney may start working right away, but sometimes the transplant kidney takes a little longer to work. In this case, you might need to continue dialysis until the transplant kidney gets going. You will have blood tests every day to check how the transplant kidney is working. If the transplant kidney is working, you may need to drink lots of fluids. It is important that you get out of bed and start walking, slowly at first. You will be taking medications to stop your body from rejecting the new kidney. These are called anti-rejection drugs or immunosuppressants. You may feel better right after the surgery, but sometimes it takes a while to adjust. A working kidney transplant will keep you off dialysis, but you must take care of that gift of life. Taking care of your transplant kidney means living a healthy lifestyle, healthy food, regular physical activity, and no smoking. Remembering to take your anti-rejection medications every day and as prescribed will keep your new kidney safe. Having a kidney transplant still means regular medical appointments. Please make sure to attend them or call your transplant team when you cannot. The benefits of having a working kidney transplant generally means a better quality of life and a longer life than if you were on dialysis. There will be fewer dietary and fluid restrictions. As your quality of life is better, you are more likely to continue to go to work and go to school. There are several things to consider when deciding whether to have a kidney transplant. A kidney transplant is a major surgery, and therefore there are risks associated with the general anesthetic and surgery itself. There is always a risk of rejection. Your body does not like the new kidney and damages it. However, the risk of rejection is less with current medications called immunosuppressants, which must be taken every day. These immunosuppressants have some side effects, which you need to know about. These side effects include a possible higher rate of infection, increased risk of some cancers, especially skin cancers, possible changes in your appearance and increased risk of diabetes, high blood pressure, and high cholesterol. The transplant kidney may not last a lifetime. However, transplant success rates are now very good. In this module, we talked about what a kidney transplant is and the types of kidney transplant, living and deceased. We reviewed who can have a kidney transplant, what the transplant workup means, the transplant waitlist, and a bit about the transplant operation. We also discussed the benefits of a kidney transplant and some things you need to consider before getting a kidney transplant. If there is anything more you would like to know, please write down your questions and ask someone on your kidney care team.